Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. So, in this presentation, we'll talk about the medial nerve compression, that is clinical anatomy of the medial nerve. So, there are three separate syndromes which are recognized. First is carpal tunnel syndrome, second is pronator syndrome, third is anterior interosseous syndrome. So, carpal tunnel syndrome is a compressive neuropathy of median nerve as it passes through the carpal tunnel of the wrist joint. So, median nerve is compressed at the wrist, resulting in numbness and pain in the thumb, index finger, middle finger, and the half ring finger. Causes can be idiopathic, inflammatory, post-traumatic, and endocrine. And high prevalence rate has been reported in persons who have performed certain repetitive wrist motions, or in pregnant women, or in gout arthritis. Signs and symptoms are pain of the hand and wrist associated with tingling and numbness. Typically, the patient wakes at night with burning or aching pain and shakes the hand to obtain relief. And there will be also a thenar atrophy and weakness of thumb opposition. Physical examination by Phalen's maneuver, Tinel sign, carpal compression test, and diagnosis by history, physical examination, and NCV, nerve conduction test. Treatment can be splinting to prevent wrist flexion. Corticosteroid anesthetic and injection give temporary relief, and also by surgical decompression. Wearing a lightweight wrist splint, especially at night, and take it mild analgesics. If symptoms persist or reoccur, if hand weakness and thenar wasting develop, the carpal tunnel can be surgically decompressed by using a open surgical division of the transverse carpal ligament. Complication of surgery can be hematoma, artery injury, hypertrophic scarring, injury to palmar or cutaneous branches of median nerve. Next syndrome is pronator teres syndrome. In pronator teres syndrome is a compression neuropathy of the median nerve at the elbow between the head of the pronator teres. It is a rare compared to the carpal tunnel syndrome or isolated injury of the anterior interosseous syndrome. Symptoms are similar to the carpal tunnel syndrome, although night pain is unusual and forearm pain is more common. Phalan tests obviously been negative, and symptoms can be provoked by resisted elbow flexion with forearm supination and by resisted forearm pronation with elbow extended. Tinel sign may be positive in pronator syndrome. Next is anterior interosseous syndrome. It is a medical condition in which the damage of the anterior interosseous nerve, that is a motor branch of the median nerve, causing pain in the forearm and characteristic weakness of the gripping movement of thumb and index finger. Most cases are due to compression of the nerve as a result of trauma at the elbow, often associated with hemorrhage into the deep musculature. Thank you.